Imagine if we could reshape how we think about substance abuse disorder treatment. Although using opioid treatments may be scary, they are one of the most effective ways to heal. Think about the story of the 3 little piggies.
Once upon a time, there were 3 little piggies, but in this story, they were victims of substance abuse disorder. One day, they decided that they wanted to recover and reached out to different medical providers for assistance. Their goal, a treatment that would successfully help them recover from their addiction for good.
The first patient, in fear of the doctor's judgment, didn't share how bad their current condition was, believing that they would be able to overcome their addiction all by themselves.
The second patient was recommended to a rehab program where they would stop using the opioid and attend lots of counseling and self-healing sessions.
The third patient was recommended to replacement therapy. This patient would first be prescribed buprenorphine and then methadone if the buprenorphine plan did not work. During this, they would also attend therapy and counseling.
And buprenorphine is an opioid used in replacement therapy to substitute the opioid they are addicted to. It is given in low to moderate doses and produces euphoria and respiratory depression that prevents the patient from having withdrawal symptoms and cravings. It is shown to be an effective recovery strategy when paired with other treatments such as counseling and therapy.
Similarly, methadone is another opioid used in replacement therapy that can help with recovery by creating a similar feeling as the drug the patient is addicted to.
However, despite methadone and buprenorphine being similar treatments, methadone often carries a negative stigma. As the oldest and most used medication for opioid use disorder treatment, it has faced lots of backlash for replacing one addiction with another. Methadone is also often associated with heroin and tends to have a higher misuse and overdose potential, which has hurt its reputation.
Let's recap the 3 treatment plans. When looking for an opioid use disorder treatment, avoiding the problem and attempting to stay away from the drug simply isn't enough. Withdrawal symptoms, which lead the patient back to their addiction, is why this treatment often fails. Or in other words, the first little piggy straw house would fall to the wolf's blow.
The second treatment plan of solely attending a rehab program and therapy is usually not enough to combat the patient's addiction, and the patient will still struggle from withdrawal symptoms. So when the wolf comes for the second piggy, the stick house will also fall.
The third treatment plan of replacement therapy with counseling is an exceptionally effective treatment. When substance use disorders face a strong treatment plan that combines multiple methods, studies have shown a better recovery. Therefore, when the wolf attempts to blow down the third piggy's house, it will not fall.
The negative stigma towards opioid treatments, specifically methadone, is due to the belief that using the opioid is replacing one addiction with another, making recovery more difficult. However, when taking the proper precautions and combining the treatment with other rehab methods, it has actually proven to be very effective. The stigma around these treatments can often be a barrier to the integration of policies and programs addressing the opioid crisis.
Society can help break this stigma through using more inclusive language, such as replacing terms like addict and clean with words like substance abuse disorder and recovery. We should emphasize the societal versus individual causes of addiction. While drug use may include an element of personal choice, it is important to remember external factors, like the possibility that a simple leg injury could lead to the use of a prescription opioid and lead to an abuse disorder.